Hi, I am Dr. Venkant D. Nagrajan. I am a consultant cardiologist and head of heart rhythm services at Kokilaben Dhirubhai Ambani Hospital, Mumbai. I am going to today talk about incidents of sudden cardiac death in people who have never been diagnosed with heart disease. You may wonder, or one may wonder, am I at risk of heart disease? You may have heard recently of celebrities who have never been diagnosed with heart disease experiencing this sudden death, or one of your distant relatives or friends, or you've heard from your family of a person who's never been diagnosed with heart disease and has died because what they think he's had a heart attack. So what is the definition of a sudden cardiac death? Sudden cardiac death is defined as a death that occurs in a person within 1 hour of onset of symptoms. So the person may have been completely normal before, has some onset of symptoms, and then he experiences death. In a vast majority of people, it is because of underlying heart disease. So in fact, we know that 50% of deaths that occur because of a heart attack occur within the first hour of symptoms. So it becomes very important for us. How do we protect ourselves? Have we got heart disease? Is something that runs through every adult's mind. And how do we protect? What are the symptoms that we look for, or is there any particular things that we have to pay special attention to try and diagnose this heart disease in time, and so that decrease the risk of experiencing sudden cardiac death or protect ourselves? So let's look at what is the risk factors for heart disease, then we will understand how to protect ourselves. We know that hypertension, is high blood pressure, is one of the risk factors for developing heart disease. So in a study that was published in 2019, which was done in Indian population, middle-aged people, it is surprising to note that 4 out of 10 people who had high blood pressure did not even know that they had high blood pressure. So what the clear message from that study is, if you have not already got your blood pressure checked, you should go to your doctor and ask, have I got hypertension? Because high blood pressure may not cause symptoms until late in the disease, by which time a lot of damage has been done to your arteries. Now, the second disease that you need to look for is whether you are a diabetic. Now, we are in the middle of a diabetic pandemic in India. That's because of our changing lifestyles, increased prosperity, and we are eating more and more foods outside, which are not so healthy as they were compared to what your grandparents or people in India had 50 years back. So diabetes is something, again, may not cause symptoms until the damage has been done. So you will have to look for if you are a diabetic. Now, third is no-brainer. If you are a smoker, smoking increases the risk of heart disease, and smokers experience sudden cardiac death with a frequency that is twice that of people who do not smoke. And smoking, and it has been shown in the studies that in women, even smoking as 1 cigarette a day can increase your risk of developing heart disease. So if you are a smoker, you should consider give up smoking. If you are a not smoker, you should not think of smoking. Now again, excess alcohol intake. So excess alcohol intake is defined where you are going to have more than 5 to 6 units of alcohol on a single night. So if you have the same 6 units of alcohol spread over 3 or 4 nights in a week, that's fine, but try and avoid excess alcohol intake or binge drinking on a Saturday night or a Friday night or over the weekend. Now again, if you have a family history of heart disease, you should go to a cardiologist and get yourself checked, get a ECG, which is an electrical recording of the heart, to look for any abnormalities, and an echocardiogram, which is an ultrasound scan of your heart, to look for if you have any weakness of the heart muscle. Last but not the least, if one of your family members has experienced a sudden cardiac death, it becomes important for all the siblings and those who are first degree relatives to get themselves checked for heart disease. And it is always advisable to lead a healthy lifestyle, do regular exercise. If you have got a stressful job, try and find what will de-stress you, and also take care of people around you, and if you find that their lifestyles are not healthy, try and advise them.